And that's a great transition right there because, healthcare doesn't really come up much in the show itself, in the West Wing show. And as you say, until healthcare is sort of front and center, it's not part of the vernacular. When I would say to my parents, Secretary Azar or Seema Verma, they'd just look at me like, I don't know who these people are. But the reality is that, these are important. They were important roles before because they come up on the show all the time. I mean, they're central to the things that we do. But how do you think the pandemic has really changed those roles?
Well, I will say on the positive side, the pandemic has revealed the opportunity to make progress through executive action. So let's just let me wind the tape a little bit, Bill. Uniquely American story about healthcare delivery is that the government is regulator on a private sector system. We are an operator in the VA, and we are a fiscal agent in terms of, balancing the budgets and thinking about American competitiveness. So you've got multiple hats on how a government thinks about healthcare. And by and large, actions that are needed, like healthcare reform, must go through Congress. And we wait for that once in a generation opportunity to get the Affordable Care Act or the, annual absolute knock'em sock'em fight on the physician pay. Back then it was if you remember, we used to the doc fix every year. Congress would sort of, statutorily say we're going to cut doctor pay 20%, and then every year create a crisis that had them, fixing it, whatever that means, and then tacking on policy along the way. So we had this like big capital P, legislative branch, executive branch dance that required, a lot of moving parts. In the pandemic, we've realized we've got a lot of authorities on the books today that we've used some, but we have much more we can do to make the healthcare system work better. And no obvious area captures the imagination more than telehealth. So imagine the world pre-COVID. It was a minuscule part of our reimbursement model. You had to be rural, very narrow use cases. The private sector would fund stuff, but it wasn't really at scale. And now you've got the Livongo Teladoc merger at $18.5 billion. Disclosure, I work with Livongo. They're members of Care Journey, and I love Glenn Tolman. The point here is that we've come a long way through effectively executive action on just one component of healthcare. Then you look at the payment authorities in terms of how to allocate the funding for provider relief. They have a lot of policy levers they can introduce, rules around data sharing for COVID lab reporting. Big fight in the Congress and the public today about how poorly our data systems collect race and ethnicity information and other inequities. So the executive branch in the pandemic has sort of exercised muscles that maybe have always been there, but have been cautiously used, and now they're being used to their fullest because we have no other choice. There's no turning back, Bill, on a lot of these items. We'll get into that as you proceed this discussion.
Yeah.